Welcome back. Now, gout is a very ancient disease. It was described by the Egyptians in 2600 BC, and the physician Hippocrates in ancient Greece around 400 BC described it as an unwalkable disease because this arthritis was the type that affected the toes. And he also noticed it was higher in those people that ate very rich foods. In the 1500s, it was known as a disease of kings, especially King Henry VIII had it. And in the 1700s, there were some people who were honored to have gout because it was a sign of wealth. Nowadays, gout is very common and it probably affects, in some countries, up to 1% of the population. Now, what is gout exactly? So, when our bodies eat certain foods that are rich in purines, meaning things that have a high purine content, such as certain meats or alcohol or seafood, the body will break it down, and the byproduct is called uric acid. And this uric acid is gotten rid of through the kidneys. However, when this system gets overwhelmed and the patient is maybe ingesting too much of these things and uric acid is building up too high, what happens instead, now the uric acid can't fully dissolve in the blood and it turns into a crystal and goes and sits in a joint. The body sees that crystal in the joint and the immune system starts attacking it, thinking that it's an infection or mistaking it for an infection. And as a result, the joint that it's sitting in also gets damaged. The risk factors of gout are many, but most commonly are genetics when patients are missing certain enzymes or certain things in the body that can get rid of this uric acid. The other biggest risk factor is alcohol because it's very, very high in purine and it can overwhelm the natural system that is there. And then third is the metabolic syndrome. These are patients that are very overweight, have high blood pressure, high cholesterol, and eat a very sugary diet. As far as how does gout show up on the outside? Well, the first thing it does, it gives a very hot, red, painful joint. And we know it's very painful because a rheumatologist by the name of Dr. McCarthy and the trainee at the time that he probably didn't like very much, both injected their knees with gout crystals, and they were supposed to keep track in a diary what happened at every phase. However, within a few hours, it was so painful that they gave themselves pain medications and medications to end the flare. When gout crystals build up in certain areas of the body, it can be called a tophi, or little bumps of gout that can happen all over the body. And then gout can also affect the kidneys in two different ways. It can cause kidney stones because, again, the kidney is trying to urinate out that extra uric acid, but also it can deposit in the tissues of the kidney itself, giving chronic kidney disease. And then finally, gout can also attack the joint itself because, again, the joint is sitting there where the crystal is and it gets attacked as a byproduct. So it can lead to some permanent damage. As far as the diagnosis of gout, most commonly, it's made by getting a good history from the patient or listening to what the patient is saying. Usually these flares last about 3 days or more. They're very hot, red, tender, painful joints. Usually the very first flare happens in the first big toe, which is called pedagra. And my patients will say it is so painful that even like touching the toe lightly with the bed sheet is excruciatingly painful. The second thing that can happen in these patients is because during the gout flare, remember the uric acid is now lower in the blood and it's now sitting in the joint as a crystal. So even though the patient has a typical gout flare, the uric acid level may not be high anymore in their blood. And in this case, sometimes the joint has to be drained of its fluid and the fluid can be looked at underneath the microscope and then crystals can be seen. As far as treatment of gout, it really depends on where the patient is with the disease itself. So in the very beginning, gout is kind of like a one-hit wonder because maybe the patients have a high uric acid level, but not too high. And then maybe during a holiday meal, they will partake of a lot of alcohol or rich foods, and suddenly they have their first gout flare. Now, in this phase, the nice thing is if the patient is very serious about diet and exercise and eating healthy and avoiding the alcohol, they can actually never get a gout flare again. They can actually cure themselves of the gout. The second part of gout happens when these attacks become more recurrent or they come and go, sometimes even come and stay. And sometimes when they produce those tophi or they start to damage the kidneys or the joints, then medications may be needed. The medications, the way they work is they will either block the enzyme that's making the uric acid or they will help the body get rid of the uric acid more easily. However, in the very beginning of starting these medications, it can take a while for the uric acid level to fall, and as it keeps rising, sometimes patients will get more gout flares during the first few months of the treatment, which is why some patients are given a secondary medication to help prevent flares, or maybe they're given a medication to help with flares if they do occur. Now, as far as the prognosis of gout, it's actually very good. It's one of the few diseases that, through avoiding alcohol, through adopting a healthy lifestyle, losing the weight, avoiding the rich, fatty, sugary foods, patients can actually cure themselves of this disease. As Hippocrates said, let food be thy medicine and medicine be thy food. Until next time.